She demanded someone else. Said she didn't feel comfortable with him. But when her body gave out, it was his hands, steady, skilled, and the same ones she rejected, that held her life. What happened next didn't just change the room. It changed everyone in it. The fluorescent lights hummed overhead. Monitors beeped in steady rhythms. A stretcher rolled past, trailed by a nurse calling out vitals. The ER was alive with motion. Controlled chaos wrapped in white coats and latex gloves. Dr. Elijah Rowe stepped into Bay 4, clipboard in hand, stethoscope draped loose around his neck. His steps were measured. Calm. The chart told him everything he needed. Chest pain, shortness of breath, history of hypertension, nothing he hadn't seen before. The patient looked up as he approached. Mid-60s, diamond earrings, expensive handbag on the chair beside her. Her posture was stiff, her lips pursed. She glanced at his face, then his badge, then back at his face. "You the doctor?" she asked, voice tight. "Yes, ma'am," he said gently, eyes on hers. "Dr. Rowe, let's take a look at what's—" "I want someone else," she cut in, louder this time. A nurse across the hall looked up. "Someone qualified. A real doctor." The words hung there for a beat, not shouted, but sharp enough to cut, sharp enough to be heard. The nurse holding her IV line stiffened. A young intern froze, glancing at Elijah with wide eyes. But Elijah didn't flinch, didn't blink. His voice stayed level. "All our doctors are board certified, ma'am, myself included." She crossed her arms. "I don't want you." Another pause. The air thickened, not with panic, but with something heavier, familiar. Elijah nodded once, not in agreement, but acknowledgement. He didn't argue, didn't plead, just turned to the nurse beside him. "Page Dr. Mahoney. I'll step aside," he said, voice low. He handed over the chart, smooth and unbothered. But beneath the calm, the shift was already happening. It wasn't about her words. It was about what the room had felt when she said them, what the staff had seen and couldn't unsee. He stepped back, hands clasped behind him. She avoided his eyes now, looked anywhere else. Elijah turned toward the hallway. A nurse brushed past him, her shoulder barely touching his. "I'm sorry," she whispered. He didn't answer, not because he didn't hear, but because there was nothing to apologize for, not from her. He made it 4 steps, then he heard it. A gasp, a thud. He turned. She was no longer sitting upright. Her body was slumped, limbs twitching, eyes rolled back. "Seizure!" someone shouted. But Elijah was already there, already lowering her to the gurney, already bracing her head, already calling for Ativan, for suction, for vitals. The same hands she didn't trust were now the only ones between her and the dark. And this time, she didn't get to choose. The room spun into motion around him. But Elijah? He was steady. Because bias could wait. Life could not. The gasp wasn't loud, but it was enough. Her back arched slightly, chin jutting forward, eyes wide. Then vacant. Her hand knocked the water cup off the side table. It hit the floor with a hollow plastic clatter, barely noticed. Then she collapsed. Her body twisted, muscles locking, then convulsing. One arm jerked violently to the side, nearly pulling the IV line free. The nurse lunged to catch it. The monitor beside her began to scream. "Seizure!" someone called out. But Elijah didn't need the alert. He was already moving. He crossed the space in 2 long strides, dropping to one knee. His hands moved fast, sure, practiced. He cradled her head, protected her airway, called out without raising his voice. "Ativan, 2 milligrams IV, now." A tech handed him the syringe. He pushed it smoothly into the line. BP. 190 over 110. Get suction ready, clear the area. He didn't yell, didn't fumble. While others scrambled, he steadied. One hand braced her shoulder, the other adjusted her position so her tongue wouldn't block her breathing. Foam bubbled at her lips. Her limbs flailed once more, then began to settle. Someone dropped a clipboard. No one picked it up. Across the hallway, the intern who'd flinched earlier now stared like he'd forgotten how to blink. The nurse who'd whispered, "I'm sorry," was back at Elijah's side, moving on his cues. "She's stabilizing," Elijah murmured, almost to himself. "Pulse is slowing." He looked down at the woman, her face pale now, forehead damp. Still unconscious, but breathing. The same hands she hadn't wanted. The same ones now keeping her here. When the seizure passed, she lay still, one arm draped across her chest, the other at an awkward angle over the bed rail. Elijah gently repositioned it, checked her pupils, then gave a short nod. "Let's get a CT, rule out a bleed, draw labs, electrolytes, talk screen, full panel." The team moved, fast but focused now. The panic had passed. Authority had taken its place. She'd asked for someone else, but when the moment broke open and her body betrayed her, it wasn't someone else who stepped in. It was him, Dr. Elijah Rowe, and the room knew it. Not just because he acted fast, but because he didn't hesitate, because in the middle of insult and judgment, he still chose care. She hadn't wanted his hands on her, but they were the reason she was still breathing. He stood now, stepping back just enough to give the nurses room. Sweat had gathered at the back of his neck, just beneath his collar. He rolled his shoulders once, discreet, then turned toward the hallway. No fanfare, no glance for validation. Just one quiet breath before he walked away. The machine settled first. The beeping slowed, smoothed, found rhythm again. The buzz of urgency dissolved into stillness, like a song that had played too loudly and then stopped mid-note. A nurse adjusted the oxygen line. Another straightened the blanket. No one spoke. Dr. Elijah Rowe stood at the foot of the bed, arms crossed lightly, chart in hand. Not watching her, just present. Calm. The same presence he brought to every case, every shift, every person who didn't always see him as the one they'd been waiting for. Around him the staff moved softer now, slower, as if afraid noise might shatter something fragile. She stirred. A blink, a twitch of fingers. Her lips parted, dry and uncertain. Her eyes fluttered open. And then they found him. For a moment they just looked at each other. No words, no excuses. Just breath between them, hers uneven, his steady. Recognition flickered across her face, not of him exactly, but of what had happened, of who had been there when she had gone under, of whose voice had guided the room back from panic. Her mouth moved slightly. No sound came out. Elijah didn't rush to fill the quiet. He let it sit, let it speak, because it already was. The nurse at her side adjusted the blood pressure cuff, pretending not to watch. A tech paused by the curtain, waiting for instructions that weren't coming yet. And still, nothing was said. But everything had changed. The air felt different now. Not tense, not hostile. Just charged. Like something unspoken had finally been seen. She didn't apologize, didn't offer thanks. But her eyes stayed on him longer than before. Less with challenge, more with conflict. As if something she believed had cracked, and the pieces were still shifting in her hands. Elijah gave a small nod, just enough to say, "You're stable now." Just enough to say, "I did my job." Just enough to say, nothing more than necessary. He turned to leave. "Wait!" It was barely a whisper, like her throat hadn't caught up with her mind. He paused, looked back, but she didn't continue. Her lips pressed into a line. Her eyes dropped to the blanket pulled tight over her chest. He waited a second longer, then walked out, silent as before. Behind him, no one filled the space with chatter. No jokes, no whispers. The ER usually bounced back fast, but this time, the echo of what happened lingered. The kind of silence that holds weight. Not awkward. Reverent. The break room lights flickered, casting long shadows over the worn linoleum floor. A vending machine hummed in the corner. The coffee pot was half full and half forgotten. Elijah sat alone at the table, elbows resting beside a disposable cup gone cold. His ID badge hung askew from his scrub pocket. His eyes were fixed on a spot just beyond the window, where nothing moved, But the stillness was easier than memory. The door creaked open. A young intern stepped in, hesitated. Liam, new to night shifts, eyes too bright, too wide. He lingered at the door like he wasn't sure if he belonged. "You can come in," Elijah said, not looking up. Liam nodded, sat, didn't touch the coffee. There was a long pause before he spoke. "I saw what happened," he said quietly. Elijah finally glanced at him, said nothing. "You were calm," Liam added, almost apologetically. "I mean, I don't know if I could have, if someone said that to me and then—" He trailed off. Elijah exhaled, slow. "You don't treat the bias," he said simply. "You treat the body." Liam looked confused, not by the words, but by the weight behind them. "That's the job," Elijah added, softer now. "Doesn't mean it doesn't get heavy." The silence returned, but it wasn't empty. Elijah picked up his coffee, held it for a second. His fingers, steady in the trauma bay, trembled slightly now, almost imperceptibly. He noticed. So did Liam. But neither said a word, because sometimes strength doesn't mean unshakable. Sometimes it just means showing up again anyway. Liam cleared his throat. "It's not right," he said, voice low. "What she said, what we all heard." Elijah gave a small nod. "It's not new either." That landed heavier than it sounded. Liam looked down. Elijah leaned back in his chair, eyes on the ceiling tiles now. Counted the little cracks in the plaster, not because they mattered, but because they were easier to face than pity. He didn't need comfort. He needed space. Just a moment to remember that doing the right thing doesn't always come with thanks. That saving a life doesn't mean earning respect. Dignity, he'd learned long ago, wasn't armor. It was endurance, the quiet kind. The kind that doesn't clap back, doesn't curse, doesn't crumble. The kind that keeps your voice even while the room pretends not to hear you. The kind that walks into another room, another patient, another day, knowing it might happen all over again. Liam stood, unsure. "You, need anything?" Elijah shook his head. "I'm good." The intern lingered one more beat, then nodded and left, the door closing gently behind him. Elijah sat alone again. He didn't check the time. He just let the silence sit with him, not as a wound, but as a witness. The room was quiet, save for the soft pulse of machines and the distant murmur of hospital life beyond the door. Afternoon light filtered through the blinds, striping the walls in fading gold. Dr. Rowe stood just inside, his clipboard tucked under one arm. He hadn't asked to come. She had. She was sitting up now, propped by pillows, hands folded neatly in her lap like a schoolchild waiting to be called on. The strength was returning to her face, but not the certainty. "Thank you for coming," she said. He gave a small nod, didn't move closer, just waited. Her fingers fidgeted. She looked at them, not at him. "I was wrong." It came out like something she had practiced, not in front of a mirror but inside herself, over and over, until it stopped tasting like pride and started tasting like truth. Elijah didn't react, not visibly. His face stayed even, unreadable. But the pause between them stretched just enough to hold something heavy. "I didn't think—" she started, then stopped. Her mouth opened again, searching for words that didn't sound like excuses. She gave up. "There's no good way to say it." "You just did," Elijah said quietly. She finally looked up. "I didn't see you," she said. "Not really." His voice was calm, not cold, just measured. "You're alive. That's what matters." She nodded, but her eyes stayed on him. "But that's not all that matters, is it?" This time he didn't answer. Because she wasn't really asking him. Something had shifted in her, small but unmistakable. A fracture in the old framework, the kind that lets light in, if it doesn't close too fast. He watched her for a moment longer, then stepped forward. checked the monitors, adjusted a tube, not because it needed adjusting, but because the motion gave space to the silence. "You're stable," he said. "We'll monitor overnight, but your vitals look good." She nodded again, her throat tight. "I'm sorry." He turned slightly, met her eyes one last time. "Don't be sorry for me," he said. "Just don't be silent next time." There was no malice in it, just weight. Truth pressed into shape. She blinked, looked down. Elijah moved to the door, paused with his hand on the frame. "Rest," he said. "You're still healing." And then he left. No applause, no closure. But something deeper had happened. Not forgiveness, not absolution. Just a truth finally given air. And in a room where silence had once carried judgment, it now held something else. Accountability. The ER didn't stop. It never did. New patients came in. Gurneys wheeled out. Clipboards traded hands like batons in a race that never finished. But beneath the steady rhythm of alarms and footsteps, something quieter moved. A shift. A ripple. It started in the break room. 2 nurses by the coffee machine. One poured sugar with a shaking hand, still thinking about the way the woman's voice had sliced through the air hours earlier. "She said it like he wasn't even human," the younger nurse whispered. The older one just nodded. "He didn't flinch." "He didn't need to," the first replied. No one laughed. No one rolled their eyes. This wasn't gossip. It was memory being stitched into something lasting. Down the hall, Liam, the intern, stood beside the crash cart, retelling it to another resident. Not the insult, not the collapse, but the way Elijah had moved. The way he had stepped in without pause, without bitterness. The way he had made it about the patient, not the pain. "He didn't even raise his voice," Liam said, like he still couldn't believe it. "Just acted. Just cared." Word spread. Not loudly, not with spectacle, but with a kind of reverence. A nurse mentioned it in passing during rounds. A tech brought it up while restocking gloves. A surgeon nodded silently when Elijah passed him in the corridor. Not with pity, but with something closer to respect. Because there was no grand speech, no confrontation, just a moment that could have broken something, and instead revealed something stronger. The woman's words had landed hard, but his response had landed deeper. And in a place where adrenaline ruled and egos often filled the room before people did, Elijah's stillness echoed. That night, someone left a sticky note on his locker. No name, just 3 words. "We saw that." Elijah peeled it off slowly, pressed it into his pocket without a word. Not for display, for safekeeping. Because moments like that didn't ask for parades. They asked to be remembered. A shift change came. Night became morning, and the hospital spun on. But the ripple stayed. In the way people looked at him now, longer, more deliberately. In the way Liam listened more carefully during rounds. In the way a nurse gently corrected a patient who asked if there was a real doctor coming. Change didn't roar that day. It didn't need to. It moved like sound through still water, quiet, steady, undeniable. And it would keep moving. The lobby smelled faintly of antiseptic and fresh paint. Sunlight poured through the high windows, catching dust in midair like glitter that refused to settle. The hospital moved as it always did. Hurried footsteps, clipped voices, elevators dinging open and closed. But the sign was new. Mounted beside the reception desk, framed in brushed steel, the letters were bold but calm. All patients deserve care. All caregivers deserve respect. No logo. No attribution. Just words. Dr. Elijah Rowe walked past it like he always did. Coffee in one hand, ID badge swinging against his chest. He didn't pause, didn't point it out, but he saw it, and so did everyone else. A nurse caught sight of it between shifts and smiled to herself. The custodian who'd overheard more than he ever let on gave it a nod as he mopped the tile nearby. Even the security guard, usually half distracted by a podcast, stood a little straighter when his eyes passed over it. No one needed a plaque to remember what happened. But this was acknowledgement. It didn't erase anything, didn't undo the words said, the glances exchanged, the silence that followed. But it named it. It drew a line. And for the ones who hadn't known what to say that day, for the intern too stunned to speak, for the tech who looked away, for the staff who had felt the shift but kept working, this was their chance to say something now. Elijah didn't need it, but he understood what it meant. He passed it every morning, the same way he passed through patient rooms, surgical floors, break rooms where people sometimes stumbled over their respect like it was new in their mouths. He didn't need applause. He needed space, to work, to breathe, to be seen without having to fight for it. That sign wasn't a trophy. It wasn't vindication. It was a mirror, held up not for him, but for them. So they'd remember not just what happened, but how they responded, and how they could choose differently next time. Later that week, Liam caught up to him by the elevators. "Did you see the sign?" he asked, breathless like it still meant something fresh. "I did," Elijah said, with a small nod. Liam hesitated. "That was because of you, wasn't it?" Elijah looked at him, not with pride, just clarity. "It was because people were watching," he said, even when they didn't speak. The elevator opened. He stepped in. Behind him, Liam stayed still, eyes drifting toward the lobby, toward the sign, the words, the weight of what they meant. And somewhere between silence and action, another ripple began.